Welcome to the Clinical Pharmacy Counseling in Vietnam. Topic 4. How to measure blood pressure correctly. For hypertensive patients, regular blood pressure monitoring is very important. Today, with the popularity of electronic devices, patients can monitor their own blood pressure. Regularly measuring your blood pressure at home will provide a lot of information to help your doctor adjust your medication appropriately and effectively, and help you self-monitor and better control your blood pressure. To measure blood pressure at home, there are 4 types of blood pressure monitors we can use. These are mercury sphygmomanometer, semi-automatic sphygmomanometer, and automatic sphygmomanometer. In which automatic sphygmomanometer should be used, this device is easy to use, accurate and safe. You should choose a device with a cuff that is the right size for your arm. How to measure blood pressure at home correctly. The following clinical pharmacy counseling program will guide you through the steps of the blood pressure measurement process. Step 1. Prepare before taking your blood pressure. Within 30 minutes before taking your blood pressure, you do not smoke. Do not drink coffee. Do not exercise. And you should urinate before measurement. Step 2. Posture when measuring blood pressure. Within 5 minutes before measuring, you need to sit in a quiet room. Feet flat on the floor and legs uncrossed. Lean back on the chair. Not wearing bulky or tight clothing. Your arms is supported and at heart level. Step 3. Take blood pressure measurement. You begin to wrap the cuff to fit your arm. The cuff is 2 centimeters above the elbow crease. You do not talk and use the phone during the measurement. Do not watch television. Press the start button on the monitor, wait for about 1 minute, and read the result. The blood pressure is represented by 2 numbers. The first number, called the systolic blood pressure, corresponds to the pressure in the arteries when the heart beats. The second number, called the diastolic blood pressure, corresponds to the pressure in the arteries when the heart rests, alternating between beats. For example, if the measurement shows a systolic blood pressure of 120 and a diastolic blood pressure of 80 mm of mercury, we will read it as blood pressure is 120 per 80 mm of mercury. At the end of the measurement, be sure to record your blood pressure readings in a diary, and share these results with your doctor or pharmacist at each follow-up visit. It will be very helpful. Help your doctor review and adjust medication that is effective and reasonable for you. For the best results, when should you take your blood pressure? It is recommended that you should measure your blood pressure at the following times. In the morning, before eating and before taking antihypertensive drugs. In the evening, before taking antihypertensive drugs. You should also take your blood pressure at any time if you experience discomfort such as headache, dizziness, vertigo. In addition, you should take your blood pressure at least 3 days before each clinical visit, in the morning and evening. For the best results, you should take your blood pressure at the same time every day, and 2 measurements should be taken at each measurement session, performed 1 to 2 minutes apart. In addition, when shouldn't you take your blood pressure? You shouldn't take your blood pressure after drinking coffee, after eating or so hungry, full bladder, stress, anger, after physical activities. Because blood pressure is measured in the above situations will not be correct. In short, for patients with hypertension, should take their blood pressure at home regularly. That will help provide a lot of useful information to help your doctor adjust your medication appropriately and effectively, and help you better control your blood pressure. Remember your blood pressure readings like you remember your age. Thank you for listening. Please see more useful information about hypertension at the following address website, tuvanduoklamsang.com.